2. This isn't surprising given the fact that we moved into stage 2 later than other parts of the province, and public health officials are very cautious about the larger reopening. Throughout this pandemic, we have followed the advice of our public health professionals at the local, provincial, and national levels, and that must continue so as to make absolutely sure that we have a strong and safe restart and recovery. In that context, I support the decision of Premier Ford and the Government of Ontario, and will redouble our efforts here at the City to put us in a position to move to stage 3 as soon as possible. Today's news, I know, will be frustrating for some who would hope that we could have moved forward, but we must not risk public health. People have sacrificed so much to get to the stage that we're at, and we don't want to go backwards and move back further into the direction of a lockdown. It will be worse for struggling businesses if we have to go back to a more widespread shutdown, much as we want to open up safely now and as soon as we can. A number of city facilities and amenities will reopen in stage 3, including the city's more than 800 playgrounds and play structures, community and recreation centres, and libraries for all on-site services. City staff are now preparing for these additional openings so that we can move quickly when we do move into stage 3. For example, they started inspecting and readying playgrounds and play structures last week, and that work will continue. One major aspect of stage 3 is the reopening of restaurants and bars for indoor service. I know many people, including the Ontario Medical Associations, have concerns about this change. So do I. And that is because we have seen this leads to spikes in cases in other jurisdictions, and we do not want to see that happen here. We are continuing to have conversations with the province about the city's request for additional measures in bars in particular to protect public health as part of a stage 3 reopening in Toronto. I asked public health officials to provide their best advice when it comes to bars and restaurants and indoor dining to ensure that the provincial regulations guiding stage 3 do everything possible to protect the health and safety of Toronto residents and employees of the reopening businesses. Toronto Public Health worked with City Legal and Municipal Licensing and Standards to provide these possible changes, and as has entirely been the case throughout the pandemic, my letter to Premier Ford was based entirely on their advice. It is our hope that many, if not all, of these 6 recommendations could be quickly implemented ahead of any stage 3 opening in the City of Toronto as part of the ongoing excellent cooperation between the 2 governments during the COVID-19 pandemic. I know Premier Ford is just as concerned as I am about a second wave and the disastrous impact that a return to a more stringent lockdown would have on the health of our residents and the restart of the Ontario economy. We have seen in other jurisdictions that further reopening can lead to increased outbreaks of COVID-19 and growing case count numbers. We absolutely, positively do not want to go in that direction. I firmly believe that for the good of the province and the city, we must continue to move forward safely, but we must also do everything we can to continue to stop the spread of COVID-19. So the changes that I have conveyed for consideration by his government with respect to indoor service in bars especially and in restaurants are fairly simple. 1, requiring customers of indoor food and drink establishments to be seated at all times unless walking in or out, going to the washroom or paying the bill. The present requirement applies only while people are actually eating or drinking. Only then would they have to be seated. 2, requiring restaurant and bar operators to keep a customer log with a name and contact information, along with the date, check-in and check-out times, and the table number, and keep that information for 30 days. Right now, this is only a Toronto Public Health recommendation, not a provincial requirement. 3, implementing additional capacity restrictions for food and drink establishments that limit occupancy to ensure that physical distancing can be easily maintained by all patrons. Right now, there is no cap provided that distancing can be maintained. 4, implementing early closure times for food and drink establishments for at least an initial period of time, similar to what has been done in Quebec. In this case, we have suggested midnight, as in Quebec. 5, requiring establishments to implement COVID-19 screening protocols for staff, such as completion of a screening questionnaire prior to the commencement of their shifts. And 6, outlining clear, mandatory face covering requirements for staff and patrons of bars and restaurants in the amended Stage 3 order. According to our health officials, these establishments present a higher level of risk of transmission of the COVID-19 virus. I support the province introducing these measures as part of moving the Toronto City to Stage 3. With today's decision, we have time to make these changes and to communicate them to bars and restaurants. I believe they will ensure that the progress we have made by following public health advice consistently will continue. And I also believe that businesses will follow these measures because they will understand that measures like this will protect their customers and employees and help prevent a spike in COVID-19 cases that could ultimately lead to a return to a more restrictive series of measures, including a return possibly to the closure of these very same businesses as we've seen in other cities. We are making progress in a number of areas. Parks Play TO is up and running, offering free drop-in and activity-based recreation programs to children at multiple locations across the city, free of charge. And Summer in the Six also began today. It offers slightly older young people, aged 13 and up, opportunities to drop in and to meet up with friends and to participate in the fun-themed activities. I was in the ward of Councillor Francis Nunziata today to see these programs in action on their first day. And there seem to be a number of young people having a very good time. And I want to in particular extend my personal thanks to our park staff for working to provide programming for our young people this summer. You know, we've gone from a situation where there were plenty of programs planned and in fact registration had been conducted, same with summer camps, to having to wipe all of that away in light of the public health requirements. And the staff in a very short period of time came up with and implemented summer camp and recreational programs that thousands of young people will be able to take part in across the city. And I think that's a good thing for those young people, it's a good thing for their parents, and it's a good thing for the city. Cafe TO also had a major push at the end of last week that has now ensured that we have more than 5,485 meters of new patio space to help restaurants and bars. Patios and cafes were installed in some major business improvement areas over the weekend, including Little Italy, Leslieville, Yonge and St. Clair, the Entertainment District, St. Lawrence Market, Corso Italia, St. Clair Gardens, and Queen West. The total number of restaurants benefiting from Cafe TO presently stands at 386 due to 213 curb lane closures, up from 148 curb lane enclosures on Friday, and that number is rising every day. Finally, I would like to let you know that I have today written to the Greater Toronto Apartment Association to urge them to have mandatory mask rules in the common areas of their rental residential buildings. Our city mask bylaw applies to public indoor spaces, like stores and malls, but does not apply to private residential properties. I know that many tenants want to make sure the common areas in their buildings are as safe as possible, and in that regard, they have been communicating with me and asking me questions through the media about the putting in place of such a mask policy. I believe that implementing these rules in buildings will help residents protect each other from the spread of COVID-19, especially when you take into account the number of Torontonians who live in rental residential apartment buildings. It is an act of good corporate citizenship by landlords to have such a policy in place that would come at no cost and would make a significant additional contribution to the war on COVID-19. In the case of condominium buildings, such as the one that I live in, the condo corporations have in many cases, including my own building, implemented such policies and have simply posted city signage saying that people should wear a mask. People comply because they too are good citizens, because they want to protect the health of each other, and because we are all in this together. I am hopeful that the Association of Apartment Owners will strongly encourage its members to adopt a similar policy requiring face coverings in common areas such as the lobbies, the laundry rooms, and the elevators of residential rental buildings. While I suspect some buildings and some landlords may have already done so, many have not. And we know this because we continue to hear concerns from tenants. This would be one more example of how people and organizations across the city are working together to protect the health of our residents and to save lives. That's what it has taken to get to this point, and I'm confident that as long as this cooperation continues, we will be able to move fairly soon into stage 3 and beyond. And when that happens, it will be because the vast majority of Torontonians, all of you that are watching out there, have done and continue to do the right thing. And so once again, because I don't think I can say it too often, I want to thank you for listening to public health advice, for showing the patience that you have for months now. I think I heard somebody say this morning it was 19 weeks, and for understanding that we really are all in this together. I'd like to invite Dr. Davila now to provide her update for this Monday.
Thank you, Mayor Tory, and good afternoon, everyone. Over the past 3 days, there were 107 new COVID-19 infections in Toronto. To date, 13,498 people have recovered, an increase of 121 since Friday. We are still seeing some fluctuations in our local case counts, but overall, our numbers are moving in the right direction. As Premier Ford shared earlier today, Toronto will join other parts of the province in stage 3 of reopening at a later date. While some may be disappointed with this news, if we move to stage 3 too quickly, we risk losing the progress that we worked so hard to achieve together. We need to move forward with caution and with care. We all need to try our very best to stop virus spread, and this means continuing to prepare for stage 3. As the Mayor indicated, we are seeking changes to be made to the province's stage 3 order that apply to Toronto. We made these requests because we are concerned with what we are seeing in other cities that have resumed indoor service in bars and restaurants. Cities who were a few weeks ahead of us in their outbreaks and have since reopened are now seeing increases in COVID-19 activity linked to reopening of restaurants and bars. In some cases, cities that had had very low or no COVID-19 activity are now seeing increases in cases linked to these settings. Fortunately for Toronto, we are able to learn from the real-time experience of other cities. My team and I continue to watch and learn from cities and countries that are ahead of us in reopening. And around the world, the evidence points to the importance of a slow and steady reopening. We must accept some risks with reopening, but the critical point is to make informed decisions that balance the risk with the potential benefits. We need to find the balance that helps our city to move forward in the safest way possible. The reality is, indoor public settings, such as bars and restaurants, present a higher level of risk because they involve the 3 C's of COVID-19 transmission: crowds, close contact, and enclosed spaces.